What are the effects of elevated glutamate levels? What happens when glutamate levels rise too high in the brain? This question is particularly relevant in the context of schizophrenia research and genetics. Glutamate is the most common excitatory neurotransmitter in the brain. It plays a vital role in processes like learning and memory. However, when glutamate levels become elevated, it can lead to some serious issues. High levels of glutamate can cause neurotoxicity, which means it can damage brain cells. In schizophrenia, this elevation is linked to the development of psychotic symptoms. Glutamate interacts with N-Methyl-D-Aspartate receptors, which are essential for normal brain function. When these receptors are overstimulated due to excess glutamate, it can mimic the effects of certain drugs known to induce psychosis. Research indicates that individuals who are at risk for developing schizophrenia often show increased glutamate levels. This spike can potentially trigger a transition to psychosis. Notably, brain regions like the basal ganglia have been observed to have elevated glutamate in those diagnosed with schizophrenia. Additionally, the balance between glutamine and glutamate is often disrupted in these individuals, indicating possible issues with glutamate metabolism. Understanding the effects of elevated glutamate levels is important for developing biomarkers for schizophrenia. Biomarkers are biological indicators that can help diagnose or predict the progression of a disease. In schizophrenia, monitoring changes in glutamate levels could assist in early diagnosis and guide treatment strategies. From a treatment perspective, managing glutamate levels could involve medications or therapies that target glutamate pathways. While current antipsychotic medications mainly focus on dopamine pathways, future treatments may need to address glutamate imbalances. This approach could lead to more effective symptom management for those living with schizophrenia. In summary, elevated glutamate levels can have profound effects on brain function, particularly in the context of schizophrenia. By continuing to study these levels, researchers hope to develop better diagnostic tools and treatment options for this complex condition.